Now that we have a good idea of what the functional vision head impulse test is, what populations it may be appropriate for, and how to perform it, let's talk about one of the most important things to know about this test: how to interpret the results. We know that the success of a new test in your clinic is only as helpful as how it is for your patient and how it changes their rehabilitation course. So let's talk about the results that you're going to get from the functional vision head impulse test. First of all, let me give you a quick overview because there is a lot of data that we get from this test. I'm going to just show you a video of the summary screen that you see for the fvHIT test. You'll be brought to this page. If you look at that left blue toolbar, you're going to see all the subtests that were done as a part of this assessment. So first, we always start with that static visual acuity test. So you can click on that subtest to see the data from it. The visual processing time for that patient. You can also click to see that individual information. And then you can see each subtest that was created and that was completed. So right now we're looking at the lateral for the functional vision head impulse test, and you're seeing all the raw head impulse data. And here I'm just editing a few things, taking out some maybe outliers or poor head impulses, and removing those from my data set to make sure that the information that I'm looking at on the summary screen is the most accurate. So if you're ever looking to evaluate the raw head impulse data and look at how the patient performed for each head impulse, this would be the place to look. And again, you can look for lateral, LARP, and RALP. Ultimately, most of your interpretation time will be spent on this summary screen. So the summary screen has three main components that we're going to be talking about. One of those is called the average correct response rate. We've got the percentage correct score, and then the correct response count. And these three items are really going to be your focus of attention when you collect data on a patient, because they will help you determine good next steps for how to get that patient feeling better and improving in their symptoms. So let's break it down. We're going to go real slow, step by step, in kind of the order that I have been using this test on in my patients. The first thing after I collect data that I look at is in this top left corner. It is called the average correct response rate. And this is a percentage score that tells us how many times the patient got something right versus how many times they got something wrong. Now, we know the task for the patient in this test is to tell us which direction that open part of the U is facing. And so if they got the answer right, it counts as a correct answer. And if they get it wrong, obviously it's incorrect. All of those impulses and all of the answers are collected together to give us this average correct response rate. And ultimately, this calculates all the correct impulses throughout all the speeds from all the impulses collected. So correct overall is really how we calculate this average correct response rate. This is the first number I look at because it gives a very quick idea of how the patient performed for rightward versus leftward head impulses. And it does it, of course, it takes into account all the data. So we're not looking at speed specific data. We're just looking for every time the head went to the right, how did I do? Every time my head went to the left, how did I do? Because ultimately, that's a good first question to answer is there an asymmetry for rightward head impulses versus leftward? And we many times are trying to answer this question throughout vestibular testing, right? We're trying to figure out which is the problem side. Are they both problem sides for that patient? So this is the first thing I would look at to see, is there any big differences between those average correct response rates? When you look at the research for the functional head impulse test, you're going to notice that this is the number that's most often reported. Research tends to focus on this average correct response rate to determine how specific populations do on this test. So if you look into any of the studies that are already out there, this is probably the number you're looking at. Now, most of the research that's been published shows that normal individuals perform about 88% and above for their average correct response rate. Now, there is some caveats, of course, with that number, because every research study so far has been performed a little bit differently. They're focusing on different acceleration bends or head speeds. So we have to take all of that normative data with a little bit of a grain of salt because it's not performed in the same capacity as our testing may be done here. In addition, those average correct response rates they have a large variability. So a lot of the studies that have been reported that say, oh, most people do about 88% and above, there's usually a pretty wide range for normal. It can be plus or minus 10%. So it can be anywhere from 78 to 98% is considered normal. And while we've looked at specific age populations in the research, there still needs to be a lot more research done on how certain ages are supposed to perform with this test and what's realistic for a patient to perform at different speeds. Let's take a peek at the second main thing I look at on this summary screen, and that is the percentage correct score. So you'll notice on the left side of the screen are your percentage correct scores for the lateral, the LARP, and the RALP canal planes. Right now, we are looking at the lateral canal plane, so the horizontal semicircular canals. Now, the percentage correct score, again, just looks at how many right and how many are wrong in a percentage format. You'll notice that the red bars represent our right lateral head movements, and then the blue represents left lateral head movements. And if you're an audiologist like me, or you've been using our equipment for a while, you're used to red being right and blue being left. So this is a very easy visual way to see how the right and the left ear did in this test. The y-axis looks at the percentage correct, and ultimately, if a patient performs perfectly, you're going to see 100% across the board. So you'll see 100% in every single speed bin. The x-axis shows our acceleration bins, and this is the speed of head movement. We look at 1,000 to 7,000 degrees per second squared. So on the left side of our graph is the slower head speeds. On the right side of the graph is those faster head speeds. And so you're able to quickly look at how did the left ear versus the right ear do at different head speeds. And this is really where you may be looking at this graph for. You're looking for patterns of performance. Does the patient's performance get worse as the speed gets faster? Or do you see that performance is pretty equivalent across all the speed bins? Answering these questions from this graph may be very helpful information for you to know as you prepare your patient's next steps for rehabilitation. The last thing that I look at on the summary screen is the correct response count. And again, you'll notice that the red represents the right lateral, the blue represents the left lateral. Little bit different here, the y-axis is the total number of impulses. That's how many head movements did I do to the right versus did I do to the left. So you'll notice depending on the speed bin that you're looking at, there's different number of impulses that were collected in each speed bin. Now, part of this, as you're getting comfortable doing this test, you'll notice that technically, as a clinician, sometimes it's hard to vary our speed, especially if you're used to performing the video head impulse test, where you're really looking for the same velocity of head movement, each head impulse to the right or to the left. It could be a challenge to start varying your head speed for that patient. So sometimes you'll notice as you get started with this test, you may have a high number of impulses in those mid ranges, 2,000, 3,000, 4,000, 5,000 degrees per second. That might be your comfort zone. That might be your muscle memory because you are used to doing that head speed for the fvHIT test. So you will have to be challenged. And there's, of course, ways to see as you're doing the testing on the patient, what acceleration bin you're doing and how fast you're doing that, so that you can alter your speed accordingly. But this is a nice cross-check for you as a clinician to say, did I vary it in a good way for that patient in order to get good results across the head speeds? And really, it can also provide insight to maybe why a patient performed a certain way. Did they obtain a really low or really high number of impulses in one bin that may have impacted the results? So one example I've seen, and it's been the case for me and my patients, if the patient performed 50%, so let's say we looked at our percentage correct score graph on the left side of the screen and we saw that a patient performed 50%. And then we look at this correct response count. Did they perform 50% because you only collected 2 impulses and they got one of them wrong? Or did you collect 12 impulses and they got 6 wrong? Now, really, the reason we were looking into the number of impulses is there's more validity in the results when you have more impulses, right? You need to have at least 3, ideally 5 impulses per each acceleration bin to be able to rely on that data. Because if we only have 1 impulse or 2 impulses, Like you'll see in my example here, in the 5 to 6,000 degree per second acceleration, then you'll notice for that right lateral, only 2 impulses were completed and collected. Luckily, the patient got both of them correct, so it showed 100%. So we probably weren't concerned at looking into that. But if the patient would have got one of those answers incorrect or both of them incorrect, it could have been a 50% or 0%, which is just dramatically different performance. So looking at the number of impulses collected helps you validate whether you should trust or look into that percentage correct score a little bit more, because we know the more data, the more valid the result likely is. So I would recommend getting at least 3 impulses per bin, which can be challenging depending on certain populations or as your technical skill continues to improve. 5 would be the ideal, 3 would be acceptable. Now, again, looking at our summary page, we've talked through this average correct response rate in the top left corner. On the left side of the screen, you've got your percentage correct score for lateral, LARP, and RALP canals. And then on the right side of the screen is your correct response count, again, for lateral, LARP, and RALP canals. If you are to perform more than one assessment on each canal plane, you will see, like you do in our other tests, you're going to see a black little arrow that pops up next to the title for the test, and you are able to toggle between which test you want to display on this summary screen. And as a reminder, on the individual test page, this is really where you have the ability to look at the head tracings and the ability to edit or remove the tracings that may have not been a valid impulse or some outliers. So this is really where you can look a little bit more into what patients answered correctly and was it due to a poor head impulse. Maybe that would be a piece of data that I would remove from my summary.